1. All right, good evening, everybody. So tonight's topic is cholesterol. This is something that's been coming up in clinic again pretty recently. Went through a bunch of lab results this afternoon and had to send a bunch of people some results related to cholesterol tonight. So I thought it'd be a good topic to cover. So there's a little bit of confusion out there as far as what are the different kinds of cholesterol that are out there, and how does the fat and cholesterol that you eat impact on your cardiovascular and other health, basically. So cholesterol is an essential component of pretty much every cell in the body, plus it's something that your body uses to create hormones and other things that it needs. So believe it or not, your liver, underneath that right rib, your liver is actually fairly good at making all the cholesterol that your body needs. So we really don't need to eat any extra cholesterol. The other thing that is interesting about cholesterol in the liver circulation is that after the liver has made the cholesterol for the body that the body needs, if there's any extra, it gets dumped into the intestines. And if there's a lot of fiber in those intestines, especially the dark green leafy vegetables, especially collard greens, once they showed us especially good at binding up that cholesterol and flushing it from the body. So if there's a lot of fiber in the intestines, then basically all the extra cholesterol that gets dumped into the intestines, it gets carried along the garbage chute, so to say, and then boom, it just kind of goes out the other end. And so by eating lots of dark green leafy vegetables, not only are you providing lots of nitric oxide in order to keep the blood vessels open, but you're also literally helping to sweep clean the body from excess cholesterol and excess hormones and other things that you don't necessarily need as much of. So because the American diet is very artery clogging, so to say, or atherogenic, as they call it, basically it's a diet pattern that most Americans have, which is high in fat and sugar and processed foods and so forth, that the level of cholesterol tends to correlate with the risk for things like heart disease, which is why there are some pretty famous calculators that are out there. So if you're a person who's curious to know, what is my risk of having a heart attack in the next 10 years? Yes, there's factors that go into it. For example, what's your family history like? Anybody have early heart disease or early stroke in the family? Do you have diabetes? Those things for sure put you a little bit higher of a risk for heart disease in general. But also you can use such things as whether you're a boy or girl, your age, and your cholesterol numbers. One of the most famous of these calculators is the Framingham Risk Score. And I'll put a comment below afterwards to link to that calculator. So really all you need is a few things plus the cholesterol numbers, and you plug it in and it will tell you about what your risk for heart attack is in the next 10 years. It's especially dramatic when somebody has high cholesterol and uses tobacco and happens to be a male, because sometimes, even if somebody is in their 30s, sometimes if the cholesterol is high, they can have a really high risk of a heart attack, as calculated out by the Framingham Risk Score. But what happens if we take somebody with high cholesterol and put them on a whole food, plant-based, no added oil diet? Magic happens. I've had a couple of patients who've taken me up on the 21-day challenge that Dr. Barnard has on his 21-day Kickstart program, and within a month, only 3 weeks of this diet pattern, I was able to lower cholesterol 100 points for each of these two people. One of them said, wow, this is great, my joints feel better, I feel healthier, my weight is coming off, more energetic. They loved it and they kept on with it. And the other one said, okay, that was a nice experiment, but give me my drugs back and let's just go from there. And that's perfectly okay. Everybody has a right to do what they want to do, of course. And so it's just fun that in the same month or so, I had two completely different outcomes, but both people lowered their total cholesterol by about 100 points, as well as their LDL, commonly known as the bad cholesterol, by about 100 points as well. And none of the medications that I have to offer comes anywhere close to that as far as how effective it is. So there's some recent news on cholesterol as well. The guidelines keep getting upgraded. As a matter of fact, the guidelines for blood pressure just got upgraded recently, so we gotta go dive into that too. But for the cholesterol, they don't. We used to treat towards numbers. We used to say, all right, try to get your LDL less than 70 and your total cholesterol less than 150. I mean, depending on which person's interpretation you're looking at a little bit, in order to reduce risk for heart disease, especially if you had a stroke or heart attack or diabetes or any of the other risk equivalents for heart disease, that kind of stuff. And so now, instead of treating to a number, the guidelines are much broader, and they recommend statins for many, many more categories of people. And if somebody can't tolerate a statin for some reason because of impacts potentially on memory or muscle weakness or muscle aches and pains, then the guideline used to be, okay, they don't tolerate this, let's go with a bile acid sequestrant, let's go with another type of medication like ezetimibe or something else that would try to bind to the cholesterol and lower it. Now the new guidelines are essentially statins or bust, so they always recommend diet and lifestyle changes, so the same stuff doctors have been talking about for, thousands of years: eat good food and move somewhat, do some sort of exercise. So that still applies universally. And if you want the best of the diet and lifestyle kinds of things for the cholesterol, Dr. Greger at nutritionfacts.org has a wonderful collection of video presentations on this topic. There was even one that came out in the last week about this stuff, amla powder being one of the best individual foods for lowering cholesterol. Dark green leafy vegetables are also very good, and by that I especially mean things like collard greens and spinach and such. Out of the categories, one study that I saw on one of the websites was basically saying that out of all the categories of dark green leafies, the collard greens just happen to bind that cholesterol the best and flush it from the body the best. But as far as other foods, this is something that's very easy, cheap, and easy to add into the diet. They did some studies that compared the, I forget whether it's the powdered juice or the just the powdered fruit versus some of the statins, and they found very similar cholesterol lowering effects, which was pretty fun. And plus, with the amla powder, you get a whole bunch of antioxidants and really not much for side effects, if anything at all. And the amla also has other good benefits as well. So more on that on the videos if you want to check it out later. So one of the other things to mention about with the cholesterol, so generally speaking, mentioned a few factors that go into it. People sometimes say, well, it's just genetic. My parents had high cholesterol, so therefore I'm going to have high cholesterol. There may be some role in that, especially if you happen to have a familial hypertriglyceridemia or something like that, where some people have really, really high triglycerides, or a few other familial things. But in the vast, vast majority of Americans, those rarer genetic causes are not the only thing going on. So if you look at certain parts of the world where heart disease is almost non-existent, for example, rural China or rural Africa, the diet patterns there are very different. However, they don't necessarily, in some of these rural areas, traditionally haven't had access to like canola oil or olive oil or any of these high-fat things. The meats are very expensive, and people are growing their own fruits and vegetables and so on and so forth. And the traditional diet is centered around all that really high fiber, very, very healthy food. and the rates of heart disease are very low. Famously, there's a study of, in the Korean War, they studied the arteries of the American soldiers, and they found fatty buildup already in those arteries, and those guys were only in their teens and 20s and such. Whereas when they looked and did autopsies of the folks that were living this traditional diet that was really centered around the plant foods that were native to the area, they found the arteries were squeaky clean, almost nothing in there. And so what happens if you take people that are living in these areas with this traditional lifestyle and transplant them into a Western-style dominated culture, and you find that the rates for heart disease skyrocket. There's another famous comparison in World War II where the Nazi Germans came along and took over some parts of Europe, of course, and in one area they were basically stealing all of the livestock and all the cattle, and so the people that were left behind amongst all this turmoil, basically their rates for heart disease and strokes plummeted during that 1 year that, or 2 years that they were occupied. Was it 4 years? Okay, anyway, so my friend's here correcting me as we go. But anyway, so during that time that the area was occupied, the rates for heart disease and stroke plummeted during that time, and then as soon as the liberation came, basically they got their livestock back, and sure enough, all of a sudden the rates for heart attacks and strokes jumped up quite a bit. Anyway, there's a lot of studies where they're looking at the movement of people. Even Dr. McDougall, in part of his talks, mentions about how the native Hawaiians had very low rates of heart disease and such, and then the Western influence in the foods that came in basically changed things around a lot as far as that goes. So, alrighty, so the main risk factor for that plaque buildup is cholesterol, especially the LDL we talked about, and in order to drastically reduce that LDL, drastically reduce the intake of trans fats, which is especially in processed foods and naturally occurring from meat and dairy, and the saturated fat found in animal products and junk foods, and of course a little bit of dietary cholesterol. So if you look at eggs, the egg yolks, for example, are very rich in cholesterol. Even just one egg not only raises the risk for diabetes, but also is very high in cholesterol. So the three main boosters of the LDL, the number one risk factor for the heart disease, the number one killer are heart attacks, all comes from eating the processed foods and the animal products. That's one of those main things. So, otherwise, looking over at nutritionmd.org, just glancing over to see if there's anything that I haven't talked about. Oh yeah, there's a couple of other things that I haven't mentioned as far as things that also can raise the risk for cholesterol as well. So we talked about family history and the diet, of course, and diabetes. So when people start to get their sugars out of whack, very, very commonly the ability to process and handle cholesterol also goes out of whack at about the same time. Talked a little bit about liver disease last week, I believe, and mentioned a little bit about how when these metabolic changes are happening, basically the blood pressure goes up, the cholesterol goes up, and the sugars kind of all go up at the same time. They're very tightly woven as far as mechanisms of how they feed into each other. But as people develop diabetes, very often the cholesterol, especially the triglycerides, tend to go up a little bit as the fat spills out back into the bloodstream. Chronic kidney disease is also associated with high triglycerides. Low thyroid. For many people, the thyroid, when the thyroid goes out of whack, especially hypothyroid, when the thyroid gland is just not putting out enough hormone, the cholesterol tends to go out of whack as well. Excess weight, yes, that's also associated with excess cholesterol. Not moving. So again, remember diet, exercise. So if you're a couch potato or have a very sedentary, sitting behind a desk, not moving very much kind of job, or for whatever reason are stuck to screens, unless you're watching me, of course. No, just joking. But basically, lack of movement also causes cholesterol levels to go up. Alcoholism. So I did not talk much about alcohol during the liver talk, mostly because I wanted to really focus that down on just dietary fatty liver problems. But if people are drinking too much alcohol, in the very beginning, a little bit of alcohol lowers the cholesterol a little bit. Still not recommended because of the increased rates of cancer and because of the increased rates of liver disease and directly toxic to the heart and other things with alcohol. We'll have a whole talk on alcohol one of these days as well. But basically, in the first little bit of alcohol, it tends to lower the cholesterol a little bit, and then shortly thereafter, the cholesterol rises again, depending on the amount that's used. Steroids. So when people are having autoimmune diseases or other reasons that they have to take steroids, or if they're trying to jock up and get all strong and all that kind of stuff, and use illicit steroids or try to go to the GNC and take some supplement to try to get your testosterone going or something. Basically, those steroids or the foods or the things that are converted into cholesterol also raise up our cholesterol levels as well. For the ladies, birth control can also mess with our cholesterol profile as well. So it's fairly common that when women start birth control, if we check their cholesterol levels, not too long thereafter, that you just see a rise in the cholesterol as well. And of course, tobacco we mentioned as being a risk factor for heart disease. It also, between the inactivity and tobacco, those lower the HDL. Didn't really talk much about HDL yet, but the HDL, the best way to think about that is the sweeping clean stuff. It basically helps to clear the arteries of the plaques that are in there. All right, see. So mentioned the soluble fibers. So basically, not only does the fiber sweep the body clean of, oh, thank you, Nancy, good to see you, sweep the body clean of the cholesterol, but also it lowers the insulin levels after a meal. So when eating certain foods, it can cause the insulin levels to really spike. Animal products, actually, much more than the plant products, cause that spike in insulin. And part of it is likely because of the fiber that's in there, and also the other chemicals as well. So, other couple of foods that have specific plant cholesterol lowering effects. So of course you always want to have a variety of foods. Nobody eats off of spinach alone, you know, or hopefully nobody does. And so having a variety of foods that are really rich in the soluble fibers, so oatmeal and beans and the dark green leafies I mentioned. Soy has been really well studied as well. So per Dr. Barnard here, soy protein was reduced the cholesterol that was made by the liver directly, and decreased total cholesterol by 9%, the LDL by 13%, and triglycerides by 10% when they gave people soy protein specifically. Nuts, almonds, peanuts, pecans, and walnuts all had some cholesterol lowering effects because of the fiber, the sterols that are in there, and the unsaturated fat that was in there as well. Walnuts, in one example, lowered cholesterol by about 12%, and the LDL, that bad cholesterol, by about 16%. Staying away from alcohol because it raises triglycerides by 5 to 10 milligrams per deciliter as well. So covered most of all this. I'll put in the comment section a little bit more from the up-to-date in case people have more specific questions about some of the latest guidelines and all. They have not yet updated this Beyond the Basics article with the most recent recommendations about, again, like I said, statins are best, or diet and exercise, which of course you always want to have good diet and exercise anyway because of all the other cumulative health benefits, lower cancer, lower strokes, lower heart attacks, et cetera, et cetera, et cetera, that come from eating a good, healthy, and hopefully highly centered around plants lifestyle as well. Anyway, thank you very much for joining tonight, and we'll keep you guys updated as new things come out. All right, have a good night. Until next time. Bye-bye. Thanks for watching.